Take their seats.
Thank you.
Our final speaker today is Congressman Buddy Carter, who represents Georgia's 1st District. He's a pharmacist and member of the Subcommittee on Health on the Energy and Commerce Committee. Congressman, welcome.
Well, thank you. I appreciate the opportunity to be here. I apologize for my tardiness. We can't control votes sometimes, and we just had our last vote series of this week, and before we begin a 2-week break for the Easter holiday, so we're obviously looking forward to that. It's been a very busy week, and today was momentous. Of course, we passed H.R. 1. As you all know, I'm sure, the first 10 bills, the first 10 number bills are given to the majority party, and they often reflect what the majority party is, and they not often, but they always reflect what the majority party is really concentrating on. And of course, ours was H.R. 1, which is lower energy costs. It just passed, and very pleased about that. Hopefully it will, and it will. It will lower energy costs as well as increase jobs, as well as increase the production and the exportation of energy from the United States, and also it addresses the permitting process, which right now is really crushing our economy and crushing a lot in the energy sector particularly. But I'm here primarily because I want to talk about health care. That is my expertise, if you will, being a pharmacist. There was a time I was the only pharmacist in Congress for about 6 years, first pharmacist since the early 70s, and when I was the only pharmacist in Congress, one of my colleagues had given me the hashtag OPIC to mean only pharmacist in Congress. Well, we got another pharmacist now, Diana Harshbarger from Tennessee, who's doing a great job and is on the Energy and Commerce Committee as well. But my colleague told me, he said, you can continue to use OPIC, only now it means oldest pharmacist in Congress. That really stinks, but nevertheless, I'm glad to have Diane along with us. Earlier this morning, I left an event. Today is National Doctors Day, and I'm a member of the Doctors Caucus as well. We have a Doctors Caucus, about 17 members here in the Republican Doctors Caucus, although we invite our colleagues from the other side of the aisle as well. Unfortunately, we don't have them participate very often, but we just met with, earlier today, as I say, we met with a group of doctors who were in town, and that was very important as well. But the Doctors Caucus has been very beneficial and very productive. Our leadership looks to us when it comes to health care issues. I wanted to tell you very quickly about a couple of things that I'm working on. They are, of course, pharmacy related, as you would imagine. One of the first things that I did when I got to Congress 8 years ago was to go to the FTC and to ask them to look at the vertical integration that exists in the drug pricing chain. That is, where the insurance company owns the PBM that owns the pharmacy. Forgive me if I'm talking down to anyone, and I know I'm not talking down to Nick Lukowski, who used to be my legislative health care aide, but PBM is Pharmacy Benefit Manager. What they do is to, obviously, just to manage the pharmacy benefits for corporations. And what the PBMs do, of course, is set formularies and that type of thing. Well, it unfortunately, when you have the insurance company that owns the PBM that owns the pharmacy, that vertical integration, that's what I asked the FTC to look at when I first got here 8 years ago. Finally, after 7.5 years, last summer, they finally agreed to look at it. And they are undertaking a study right now, a 6B study, to look at the impact that PBMs are having on independent retail pharmacies. Now, they've told us that it's probably going to be 1 year to 5 years before they finish this study, but they have assured us that as they go through this process, when they find egregious practices, that they will address them immediately. So we're relieved to hear that. I want to give you an example of a bill that I am sponsoring that will just give you an idea of some of the practices of these PBMs. It's called the HELPS Copay Bill, helping ensure lower patient copays. What happens is, and some of you may have experienced this, you go to your physician, they get you started on a drug, they may give you a discount card that gives you, say, $100 off to get started. Well, you present that at the pharmacy, and of course, you do get that discount. Unfortunately, what happens is the PBMs will not count that toward your deductible or toward your copay, so that the next time you get in, you get the same, you have to pay your copay, or you have to pay your deductible. And in some cases, it is a lot of money. And it's certainly more than that $100 card that you got from your physician. Well, of course, what our bill does is to say that that will not happen, that the PBMs will have to count your discount card toward your deductible or toward your copay. That's a good part of what we're trying to do also. We're also addressing transparency, as I mentioned, particularly in Medicaid, particularly with, and even in the commercial market. We're going to address it there as well. But we need to have transparency. Just one other thing, or two other things I want to tell you about. First of all, there was a study done about a year ago, a little aged now, but it was March of 2022. It was done by the Berkeley Research Group. And what it showed was that only 37% of the price of a drug goes to the pharmaceutical manufacturer, which begs the question, where does the other 63% go? Well, it's going to the PBM, to the middleman. That's where it's going. Now, look, I'm not opposed to anybody making money. We're in a capitalistic society, and more power to them. But tell me the value they're bringing to healthcare. They're not bringing value to healthcare. At least the pharmaceutical manufacturers are putting more money into research and development. Now, they need to do a better job with their pricing, too. I agree with that. But the PBMs, which are the same as the insurance company, because that's who it is, the insurance company, they're also engaging in patient steering, where they are steering patients toward their pharmacies. All of these things, they're spread pricing, where they are paying one price for the drug and then charging for another price for the drug, particularly state Medicaid programs. You just saw where the Attorney General in the state of Ohio is suing the PBMs, and thank goodness he's doing that, and I applaud him for doing that. It needs to be done. Lastly, I want to tell you about a booklet that my staff and I have put together. It's called Pulling Back the Curtains. We decided to take our issue to the streets and hear from the patients. And that's what this is. This is patient testimonies about what they have experienced with the PBMs, of how it's impacted them, not being able to get their prescriptions, not being able to get their medications, or having to get prior approvals. This is serious stuff, and it's impacting the quality of health care. Because, listen, whether it's a Democrat or Republican, we all want the same thing in health care, and that is accessibility, affordability, and quality. That's what we strive for in healthcare. I would submit to you that we need transparency. We need transparency in the drug pricing chain. We've got copies of this. We're going to leave these copies for you. I hope that you'll get one and look at it. Lastly, I want to thank you for your advocacy. Your advocacy is so very important, and you're educating yourself as to what this is so vitally important, because you need to understand what's going on. We're truly pulling back the curtains, and we're seeing the wizard behind the curtains, and the wizard is not good. So,
do you think you can pass your bill? And can you talk also broadly about the healthcare agenda for the Energy and Commerce Committee as well?
Sure. Yes, I do think that we've actually got bipartisan support for our legislation. This is. I practiced pharmacy for over 40 years. I started when I was 10, so anyway. I practiced pharmacy for over 40 years. I never went to the pharmacy counter and asked someone, are you a Democrat or are you a Republican? It didn't matter. And it doesn't matter when it comes to drug pricing. You're going to pay the same thing. So this is a bipartisan issue. We are actually working together with members on the other side of the aisle who are helping us with this. You mentioned the agenda for energy and commerce. This is part of it. Mm-hmm. Actually, this is a big part of what we hope to do in the Health Subcommittee. We're working on this, and that's a big part. The HELPS copay bill, that'll be big for us as well, and then addressing transparency. One other thing I will mention, and that's about, I guess some of you have heard of the 340B program. The 340B program was a program where hospitals, healthcare centers were able to get a discount on their medications, and it was intended essentially for the FQHCs, the federally qualified health centers, and for the rural hospitals. Unfortunately, it's evolved into much more than that now, and we see cases where we've got healthcare systems that are doing nothing more than buying up buying up these practices in order to participate in the 340B program, and that's not what it was intended for.
You're a pharmacist, as you mentioned, and your family owns pharmacy. I mean, how has that shaped what you brought to Washington, to shed some light on what pharmacists go through?
Well, let me clarify one thing. I no longer own the pharmacies,
Right.
and my family
Not you.
doesn't. I sold them a few years ago. I did own a pharmacy for 32 years, on 3 independent retail pharmacies. I also owned a nursing home pharmacy, an institutional pharmacy that serviced nursing homes, personal care homes, and assisted living homes and hospices. Hospice was a big part of our business as well. So, yes, I've got experience at it. And that's why it's so important to me, because I've seen it firsthand. I was the person on the other side of the counter who had to tell the senior citizen how much their prescription was and watch them make a decision. And I'm not exaggerating, folks. Watch them make a decision on whether they were going to buy groceries or whether they were going to buy their medicine. I was the one who had to tell the mother how much the antibiotic was going to be for her child and watch her in tears as she tried to call someone and find and get help to pay for that medication. You know, I've seen nothing short of miracles in the way of research and development over the years that I've been practicing pharmacy. And I applaud the pharmaceutical industry for what they've done. When I started practicing pharmacy, I'll go ahead and tell you, I started practicing pharmacy long before many of you were born, in 1980. If you were diagnosed with hepatitis C at that time, you were going to die. That's all there is to it. Today, we can cure it with a pill. Cure it with a pill. That's phenomenal. That's because of the research and development. The PBMs are not doing any research and development. They're not discovering new drugs. This has got to stop. This is the Attorney General in Ohio called them gangsters. That's what they are.
As far as your copay bill, do you have a Senate companion?
We do not at this time, and if you will, Jack Ganter is my healthcare aide now that took Nick's place after he abandoned us for the private market. But anyway, Jack is back here with us. We don't have a Senate companion yet, do we, Jack? But we're working on that diligently. And we are working with our Senate colleagues on some of the transparency bills as well.
Okay. What about, the Medicare was a big issue in the State of the Union. It's not going to be reformed, as I was talking to the panel earlier, but it's got to be reformed at some point. It's headed for insolvency. Healthcare is so polarizing. Do you think that can be done within the next 5-6 years?
It's got to be done. That's the key. And it's not just healthcare, it's Social Security too.
Yep.
And look, I got to be careful here. No, I don't.
You're the boss.
It's so polarizing, as you point out, and it's so toxic. Because if we in the Republican Party, if we say, we're going to balance the budget, and 70% of the budget is Medicare, Medicaid, and Social Security. But we've already said we're not touching Social Security. We're not touching Medicare, Medicaid. Right. We're never going to be able to balance the budget. We're never going to be able to do anything until we address these issues. And Medicare is going to be insolvent. Social Security is going to be, I don't know. I look out here and I see these young people. I don't know that it's going to be there for y'all unless we do something. But it's so partisan. And, God bless leadership. I'm not in leadership, but I know where they're coming from when they say, if we'll get killed if we say we're going to address it. Mm-hmm. And we will. Probably won't be back in the majority next time. But, what, and that's what I keep asking my colleagues, what's it going to take? What's it going to take for us to address our national debt of $32 trillion? What's it going to take to wake up and understand that next year we will be paying more in the interest on our debt than we will be paying for defense? And the number one responsibility of our federal government is to provide for the safety of our homeland and protect our citizens. And we're going to be spending more on the interest on our debt than we are on defense? I don't have an answer. I just have frustration.
With that said, my last question, it's budget season. The president has unveiled a budget. House Republicans are vowing to pass a budget, but how do you pass a budget when many of your colleagues want to balance the budget within 10 years, but it's not touching entitlements? How do you do that? How do you pass a budget? Can you pass a budget?
Well, right now we're up against a debt ceiling. All of you are aware of that. You know what we're dealing with there. We in our party have decided that we're going to concentrate on the debt ceiling. We want to get back to regular order. We want to pass a budget, but we don't want to take the focus off of the debt ceiling. Look, we're not going to default, okay? The United States of America is going to continue to pay our bills. We will do that. But it baffles me, this administration, why Senator Biden was willing to negotiate on a debt ceiling, but President Biden is not. I don't get that. I don't understand that at all. Of course we've got to have him come to the table and negotiate with us. We have got to cut the spending out. Inflation that we're experiencing right now, inflation is due to the spending. All the spending that's taking place. And yes, I know, you don't need to remind me. Hey, Republicans have added just as much to that deficit as Democrats have. We have added a lot to it. I get it. But we've got to address this as a country. We've got to come together and we've got to do it. I know the problem. I just don't know the solution right now. I don't know what it's going to take. But I'm going to tell you, you know, we've identified the three greatest challenges in our conference as being China, our debt, and education. And we're trying to address those things. We're trying to cut back on spending. We've got to cut back on spending. We cannot continue to get up against this debt limit and just bypass it and go on without having some kind of agreement in spending cuts.
We're out of time. Please thank the Congressman for joining us. And I hand it back to Sarah. Hey, thanks so much. Good stuff. No, absolutely.